The topic of presentation is prevalence of speech and hearing impairment in children with cerebral palsy in Muzaffarabad and its peripheries, Azad Jammu and Kashmir, Pakistan. I am the author Mariam Nasir Bhatt and I am working as physical therapist at Muzaffarabad Physical Rehabilitation Center. The aim of this study was to set the statistical base for the establishment of speech therapy services in future in the state of Azad Jammu and Kashmir. It was a cross-sectional survey that was conducted in Muzaffarabad Physical Rehabilitation Center. Both male and female children with cerebral palsy and at least 2 years of age were included in the study. Children with cerebral palsy who had comorbidities like epilepsy and mental retardation were excluded. Data was collected from the patient who visited the center from March 2019 to March 2020 via the file records and phone calls because of pandemic COVID-19. Convenient sampling was done. Data was analyzed using SPSS 21. The results have shown that out of 225 children with cerebral palsy, 158, which is about 70.2%, had speech impairment. Out of 158 children with cerebral palsy who had speech impairment, 83.5% had only speech impairment and 16.5% had speech and hearing impairment. On gross motor functional classification system, about 58% children with cerebral palsy who had speech impairment falls in the grade 4. About 93.6% children with cerebral palsy and speech impairment never consulted the speech therapist. These are the main reasons for not consulting the speech therapist, with more marked percentage of both lack of awareness about the speech therapy and lack of resources, which is 46.8%. It has been concluded that speech impairment is more prevalent than the hearing impairment among children with cerebral palsy. The main reasons for not consulting the speech therapist are lack of resources, lack of awareness about the speech therapy, and unavailability of speech therapist in the local hospitals. Lack of communication can lead to poor rehabilitation outcome, as we have seen from the results that mostly patient falls in the grade 4 on gross motor functional classification system, which means limited mobility. So communication is very important for the children with cerebral palsy to better understand the functional exercises and to convey their concerns to parents and healthcare provider. There are many implications of this research study, which includes the education of parents and caretaker about the speech therapy and its importance, to arrange the hearing assessment for the patients by improving referral linkage with local ENT specialists, and to make strategy to provide speech therapy services in future. I am very thankful to International Committee of Red Cross for sponsoring this presentation in World Physiotherapy Congress 2021 online.